In this video, we will learn how to calculate pediatric dose, especially for liquid dosage forms, and to determine the quantity or the numbers of the bottles that has to be dispensed to the patient. First of all, we will learn how to calculate the dosage for amoxicillin and clavulanic acid. There are many brands of amoxicillin and clavulanic acid in the market, such as the Amoclan, Augmentin, and Curam. Also, there are many strengths in the market, part of them given twice daily and the other given 3 times daily. The strengths that are given 3 times daily are 156 milligram per milliliter, which contain 125 amoxicillin, and the other strength is 312 milligram per milliliter, which contain 250 milligram of amoxicillin. And the strength that are given twice daily are 200 milligram per 5 ml, 457 milligram per 5 ml, which contain 400 milligram per 5 ml amoxicillin, and the last one is 600 milligram per 5 ml. These are the strength that taken twice daily. For sure, the dosage form for this strength are suspension. Uh, Tablets, we have two strength, 375 milligram and 625 milligram. So after the reconstitution of Amoclan, the total volume is 100 milliliter in each bottle. Now, in order to calculate the patient dose and milligram, we have first to determine the dose, which will be given as milligram per kilogram. So let's say the dose was 5 milligram per kilogram. We have to know the patient weight. For example, the weight was 12 kilogram. We have to multiply the dose multiplied by the weight to determine how many milligrams is um, the daily dose. Then we have to determine the concentration of the suspension or the solution. To determine the concentration, we can find it on the bottle. So for example, if the concentration was 200 milligram per 5 ml, this will mean that in each 5 milliliters of this suspension or solution, we have 2 milligram of the active ingredient or the drug. Now, in order to calculate the patient dose in milliliter, we will divide the patient dose on the strength and to multiply it by the volume, or we can calculate it by the ratio and proportion أو النسبة والتناسب. So I can say if in each 5 ml I have 2 milligram, how is the volume of which contain 60 milligram by portion and by ratio and proportion, I can have the mils that should be given to the patient. But we have should be aware about the frequency of the medication. So if the given dose is the total daily dose, we have to divide it on the number of the daily doses to calculate each dose. So if the dose was milligram per kilogram every 12 hours, that means that the patient has to take 2 doses daily. So I will calculate the full dose, then divide it by 2. But if the dose given is milligram per kilogram per dose. That means he is determined that um, this dose is for each single dose, uh, each 12 hours, that means twice daily. Then I will calculate the dose and keep it as it for each dose. Also, we should be aware about each component in the solution and which one won't be calculated. So, for example, we say that the amoxicillin, or the amoxicillin may contain um, 156 milligram per milliliter. This is the strength on the bottle. I know that the amoxicillin strength is 125 milligram per milliliter. The dose that I will use in the calculation is the dose of the amoxicillin only, which is the 125 milligram per milliliter. The examples are self-study. Please make sure to practice all the examples in order to be able to solve the cases in our simulation pharmacy, inshallah. We can use the calculation or the previous calculation steps to calculate the dosage of cefixime, and cefadinir. Um, the dose of cefixime is 8 milligram per kilogram per day, and the dose of cefadinir is 40 milligram per kilogram per day, and the duration of the treatment is 5 days. And as we say, please make sure to practice all the examples in order to be able to solve the cases in the simulation pharmacy, inshallah. The last antibiotic is the azithromycin from the Macrolides. We have the following trade names in the market: Zomax, Zithromax, Azox, Zomax, Zucine, and etc. The azithromycin is taken once daily, only one dose given for the patient daily, and the doses is scheduled as or in refer to the infection or the patient infection. So if it was moderate, then the dose will be 10 milligram per kilogram per day for 3 days, or it may be 10 milligram per kilogram for the first day, then followed by 5 milligram per kilogram for the following 4 days. But if the infection was severe, then the dose will be 20 milligram per kilogram per day for 3 days. When we say moderate infection, that means that it may be a skin infection or tonsillitis, and severe infection like otitis media, upper respiratory tract infection, and UTI. Here we can find three packaging of Zithromax. On each packaging, obviously, we can find three strengths. But we have to know that the the proportion is fixed between all azithromycin concentration, and since the proportion is fixed, we are able to have a fixed factor when we multiply it, or when we multiply it by the patient weight, that give us directly the dose of azithromycin, and this factor is 0.25. We can multiply it, as we said, by the weight, and then the answer will be in mils, and this is the daily dose for azithromycin. This table is clarify the two options for moderate infection, the 3 days therapy and 5 days therapy in regard to the patient weight. So if the patient weight is 10 kilogram, and we want to follow the 3-day therapy, then we will give the patient 2.5 ml each day for 3 days. But if we want to give the 5-day therapy, then at the first day we will give this patient 2.5 ml, and for the first day, and from day 2 to day 5 we will give the patient 1.25 milliliters.